Good day, Miss A. My name is Patricia Lane D. Gabriel from BSc 1-6, and I'm going to discuss three topics, which is the battered woman syndrome, postpartum stress syndrome, and postpartum psychosis. But first, let's begin with this topic entitled battered woman syndrome. So, battered woman syndrome is a psychological condition that can develop when a person experiences abuse, usually at the hands of an intimate partner. Abuse can affect people of any gender, age, social class, or education. People who find themselves in an abusive relationship often do not feel safe or happy. However, they may feel unable to live for many reasons. This includes fear and a belief that they are the cause of the abuse. So, this condition is the effect of different kinds of abuse of a man to their partner. The main victims of this psychological condition are women, because they are the most vulnerable when it comes to defending themselves physically. People who find themselves in an abusive relationship often do not feel safe or happy. Yes, it is definitely true. Abusing your partner will not make your relationship strong and healthy, because abusing your partner isn't a good way to treat her as your lover. Instead of treating her as a queen, you're treating her as a slave. The law for the victims of physical abuse is the Republic Act No. 9262, otherwise known as the Anti-Violence Against Women and Their Children Act of 2004. This law was published and implemented by the former President Gloria Macapagal Arroyo on March 8, 2004. Republic Act 9262 acknowledges that women who have retaliated against their partner or who commit violence as a form of self-defense may have suffered from battered woman syndrome. Any victim who suffers from battered woman syndrome should be diagnosed by a psychiatric expert or a clinical psychologist. Any person who violates this provision will face the penalty of 1 year imprisonment and a fine of not more than 500,000 pesos. The following are the acts of violence that are covered by Republic Act No. 9262. These are physical violence, sexual violence, economic abuse, and psychological violence. The best example for these three, namely physical, sexual, and psychological violence, is the case of the actor Kit Thompson and her partner Anna Halandoni. So, Kit wanted to have a sexual intercourse with Anna, but Anna refuses because of Kit's bad approach to her. Then, the physical violence enters. Kit starts beating his girlfriend until Anna bleeds. After that, Anna gets depressed and traumatized of the situation she experienced on Kit's hands. And lastly, the economic abuse, that is controlling the victim's own money or properties, or solely controlling the conjugal money or properties. So here are the causes and effects of battered woman syndrome. Causes. Abusive people believe they have the right to control and restrict their partner's lives, often either because they believe their own feelings and needs should be the priority in the relationship, or because they enjoy exerting the power that such abuse gives them. So men uses their masculine strength to abuse their partner. They enjoys it, and it makes them feel like a boss until they get used to it. In the effects, those who are abused are also more likely to develop depression, anxiety, or eating disorders. Women who are abused may also misuse alcohol or drugs as a way to cope. So, in this effect, those who are abused really needs a break in life because of the traumas, depression, the anxiety, and other disorders caused by physical abuse like eating and sleeping disorders. In short, their mental health is ruined. The main solutions to battered woman syndrome are anti-anxiety medications, antidepressant medications, and talk therapy. In the anti-anxiety medications, it helps to reduce the symptoms of anxiety, such as panic attacks or extreme fear and worry. Second is the antidepressant medications. The main use for antidepressants is treating clinical depression in adults. They're also used for other mental health conditions and treatment of long-term pain. In most cases, adults with moderate to severe depression are given antidepressants as a first form of treatment. And lastly is the talk therapy. The purpose of this is to help people identify issues that cause emotional distress. It is a way to help people with a broad variety of mental illnesses and emotional difficulties. So we are done on the first topic. Let's move on to another topic, which is entitled postpartum syndrome. So, what is postpartum syndrome? Postpartum syndrome is a type of adjustment disorder where an external, stressful event, pregnancy and childbirth, triggers feelings of unrelenting stress that are much more intense than expected. So, only mom suffers or experiences this disorder after they gave birth to their child. She's suffering from stress, feels lonely, blue, or like she feels that no one cares or supports for her. Because of the stress, there's a change of mind, body, and suddenly becomes conscious. And these are the common signs and symptoms of postpartum depression: anxiety and irritability, fatigue and lethargy, feeling guilty, worthless, hopeless, or helpless pain such as a headache or stomach ache, lack of appetite, difficulty thinking or focusing, low motivation and the lack of interest in activities, feeling unable to care for the baby, feeling unable to make decisions, withdrawing from friends and family, and having no interest in the baby or feeling as if they are another person's responsibility. And these are the causes of postpartum syndrome: past trauma, hormonal fluctuations, the physical and emotional stress of delivery and childcare, stress at work or at home, difficulty sleeping, feeling overwhelmed, not having any free time, having had an unwanted pregnancy, being younger than 20, and having a lack of support from family and friends. Mothers who give birth to their children are the ones experiencing postpartum stress syndrome. Some of them are unable to cope with their depression, which leads to suicide. Postpartum depression is treated much like any other depression. Support, counseling, or talk therapy, and prescription medicines or antidepressants can help. Talk with your doctor about what treatment is best for you. If you have thoughts of hurting yourself or your baby, get help immediately. Call a suicide hotline, a friend, family member, or 911. If you are breastfeeding, talk to your doctor about the benefits and risks of taking an antidepressant. Many antidepressant medicines are safe for breastfeeding infants. Your doctor can decide which medicine you can use while nursing your baby. Most importantly, don't assume there's nothing you can do if you are suffering from postpartum depression. Help is available and you can get better. So this kind of treatment is very effective for those who are suffering of this disorder. Having someone to talk to many can help to release your stress and anxiety. Being lonely will only exaggerate your depression, so find someone you are comfortable to talk to about your problems. And we are done to our second topic, so here is the last topic that I'm going to discuss to you. This topic is entitled Postpartum Psychosis. So when we say postpartum psychosis, it is a serious illness. Without treatment, it could be life-threatening for moms and babies and have a negative effect on the entire family. This condition carries a 4% risk of infanticide and a 5% risk of suicide. In general, suicide is the most common cause of maternal death during the first year postpartum. Studies show that family members of moms who experience postnatal psychosis have a higher chance of taking their own life, and the moms have a higher rate of suicide later in life. So, psychotic disorders are severe mental disorders that cause abnormal thinking and perceptions. People with psychosis lose touch with reality. Two of the main symptoms are delusions and hallucinations. Experts aren't quite sure why some women experience this rare condition. Because it can show up out of the blue in women without a history of mental health illness, the exact cause is not known. However, the risk of developing postpartum psychosis is greater if you have a personal health history of bipolar disorder or schizophrenia, a close family member such as a mother or sister with a history of postpartum psychosis or another psychiatric illness, discontinued mood stabilizers and or antipsychotic medications, and previous experience with postpartum psychosis after pregnancy. The definitions were very clear and understandable, so I don't need to explain them. And remember, dealing with any illness right after giving birth is difficult. And remember, dealing with any illness right after giving birth is difficult. It can be especially devastating to go through something as serious as postpartum psychosis. Not only can it be scary and traumatic to feel paranoid or experience hallucinations and delusions, but without treatment, it could be dangerous and affect the entire family. So that's all for today. Thank you for listening, and I hope you've learned a lot from what I discussed earlier. But before I end this, let me just remind you of my quotation. It's not about perfection, it's about effort.